Medication management. Hi, I'm Jane. I'm a nurse at Arkansas Support Network, also serving as the medical coordinator. I'll be helping present this course on medication management.
Hi, my name is Olivia. I am also a nurse at Arkansas Support Network, and I serve as the Personal Care Services Coordinator. This course covers what is a medication, how can you support someone who takes medications, and what should you watch out for when an individual takes medications. Section 1. What is a medication? A medication is a substance used to diagnose, treat, cure, or prevent disease. Medications may be over-the-counter or prescribed. They may also appear as generic or brand name. The generic name is the drug's chemical name, for example, acetaminophen. The brand name is the name owned by the manufacturer, example, Tylenol. Tablets and capsules may look different due to generic versus brand name refills. They may be a different shape, color, size, and possibly dosage strength. Double-check the label and confirm with the pharmacist if a medication looks unfamiliar. Ask if the dosage has changed. Certain medications require a prescription, which can be abbreviated by RX. The prescription is written by a physician or nurse practitioner, optometrist, or physician's assistant. The prescription is a legal document. Prescriptions are prescribed for and intended to be used by one person. Examples include Percocet, Wellbutrin, Ritalin, and Depakote. Over-the-counter or OTC medications can be sold directly to an individual without a prescription, but they should always be approved by the prescriber before taking them, since they can often interact with or cause side effects with prescription medication. Vitamin supplements, OTC pain meds like Tylenol and Advil must all be approved by the prescriber before the individual takes them along with their prescription meds. Examples of OTC medications are Tylenol, ibuprofen, Robitussin, and Claritin. Prescription medications are taken to the pharmacy or faxed over by the physician, and the medication is filled by a pharmacist. It is important to be able to read a prescription label. The prescription number, the pharmacy name, address, and phone number, the patient name, the instructions as to how the medication is to be administered, the name of the medication, the amount in the bottle, the date the medication was filled, the expiration date, and any special instructions or warnings will all be on the medication label. The 5 rights. When assisting a person with medications, you must ensure the 5 rights are in place: the right person, the right time and frequency, the right dose, the right route, and the right medication. The common routes of medications. Oral. Can be tablets, capsules, which are medications enclosed in cylindrical gelatin coating. Medication is generally released faster in this form than in tablet form. Powders, ultrafine drug particles in dry form, can be dissolved or mixed in liquids but must be taken immediately after being prepared. Liquids, medication is already dissolved and mixed with sugar and water. Forms of liquids can include syrups, suspensions, and elixirs. Medications can be topical. This includes eye drops, ear drops, skin ointments, which can be lotions, creams, or ointments, and patches. Medication can be inhaled, which is nasal sprays, inhalers, and nebulizers. Medication can be given in suppository form, which are large medicated bullet-shaped tablets that are inserted into a body cavity, such as vaginally or rectally. These are designed to melt at body temperature. Medication can be an injection, subcutaneous, intramuscular, intravenous, or intrathecal. Medication can be enterable. Medication is delivered to the body by way of a tube inserted into the gastrointestinal tract. These are the common abbreviations for medication. BID means twice daily. TID means 3 times daily. QID means 4 times daily. DX is diagnosis. GI is gastrointestinal. MCG stands for microgram. MG stands for milligram. ML is milliliter. PO means taken by mouth. PRN is as needed. And TAB stands for tablet.
Section 2. The role of CSPs. Responsibilities of a community support professional, CSP. The CSP is responsible for completing ASN medication sheets and submitting them to division manager, transporting the individual receiving support to medical appointments, turning in documentation of medical appointments, and getting doctor's approval for any over-the-counter meds or vitamins before an individual takes them. Responsibilities of a CSP also include being aware of all medications an individual is receiving, including each medication's name and purpose, dosage, example, 1 tablet, 1 milliliter, or 1 milligram, schedule, example, 8 a.m., or hours sleep, which means bedtime, route, example, PO, which means by mouth, side effects to watch out for, and how to respond to emergency side effects. Assisting with self-administration. You can assist by reminding the individual to take a medication at the prescribed time, opening and closing a medication container, handing the container with the medication in it to the individual, observing the individual to make sure they follow the directions on the container, assisting upon request by or with the consent of a physically impaired but cognitively able individual in removing oral medication from the container and in taking the medication. If an individual is physically unable to place a dose of oral medication in the individual's mouth without spilling or dropping it, an unlicensed person may place the dose in another container and place that container to the mouth of the individual. Observing to ensure individual swallows medication without choking on it, hiding it, saving it in their cheek, or spitting it back out, and then hiding it. If individual hides medications, this could become a life-threatening situation, since taking a large number of medications all at once against medical advice can cause death. Returning medication to the proper storage area in a locked medication box. Assisting in calling pharmacy for refills a week before the individual you support takes the last pill. Here are the steps for proper assistance for assisting the individual you support with self-administration of medications. First, wash your hands. Give your full attention to the task. Remember the 5 rights as listed previously. Assist with medication for only one person at a time. Explain what you are doing. Make sure you understand the medication being taken. Check the label and the bottle twice. Medication must be in original container. Check for the expiration date on the container. If it is expired, bring meds to Arkansas Support Network nurse office for disposal. Remind the individual what they are receiving. Watch and make sure the medication is swallowed. Report any difficulty swallowing. Record on med sheet that the medication was received. Make sure you complete documentation if a person is receiving a PRN as needed medication. PRN stands for pro re nata, or per request or necessity. Remember, a PRN is a medication taken only when necessary to relieve symptoms, on an as-needed basis rather than a routine basis. Make sure you document why the PRN was required and any changes after the individual receives the PRN. In addition to your online case notes, Weekly paper medication sheets must be maintained in a binder at the individual's home. On these sheets, note the medication the individual takes, dosages, dates, and times, and initial when the individual takes each medication. These medication sheets are turned in weekly with other required ASN documentation. A medication count is completed on Thursday evening and Friday morning. So these are the paper medication sheets that have to be maintained in a binder at the individual's home. Here you will write what the medication is, how frequently it's taken, the times to be given, starting medication count at the beginning of the week. You have to initial in each of these spots when the individual is administered the medication, and then your ending medication time and your name. Your online case notes. So when you choose the individual that you were supporting, you can go down, well, you'll have to fill out this part and then you go down and select the medication that you need to chart on. This one, metformin, taken 5 p.m. Outcome, hopefully taken as prescribed. Otherwise, you'll need to mention to your division manager that there was a medication error, refused or taken late. If you noticed any side effects, please include those. So diarrhea is a side effect of metformin. You could say diarrhea occurred. And then this client actually does have a medication to address diarrhea. That's Imodium, and it was prescribed specifically for diarrhea caused by metformin. So in this box, you can mention that you administered the PRN Imodium. So you can mention if the PRN helped, that would be a good spot to write that in. And then you can add that medication, and then you're ready to add another one. So then you'll select the next one that you're ready to chart on, and so on and so forth. Then you'll sign it and submit it. So both of those have to be maintained, the online case notes, medication charting, and also the paper form in the home.
Section 3. Medications and the body's response. Each person reacts differently to a medication. Medication absorption and distribution, how quickly a med takes effect, and metabolism and excretion, how quickly a med is broken down and flushed out of the body, vary widely based on muscle mass, fat mass, age, gender, thyroid activity, kidney function, liver function. So it is important to know each individual receiving support and keep an eye on them when starting any new medications and report any unusual side effects to the physician. Now we're going to talk about medications and specific body systems. Heart. If an individual is taking heart medication, such as blood pressure medication, help them to stand up slowly to prevent falls. If they feel dizzy while standing or walking, be ready to provide physical support. Dizziness, headaches, and nausea are common side effects of cardiovascular meds. Respiratory. If an individual is taking respiratory medication or breathing treatments, they will likely experience some common side effects like a fast heartbeat, restlessness, and a headache. If they use an inhaler, always know where it is located in case of emergencies, and keep an eye on its expiration date for replacement. Gastrointestinal tract. If an individual is taking GI medication, you can expect that moderate stomach pain, constipation, and/or diarrhea may occur. These should be reported to the physician if they are ongoing. Antibiotics. If an individual is taking antibiotics, make sure they finish the entire round or the infection will not go away. These individuals should consume yogurt or probiotics to keep their digestive tract healthy and prevent diarrhea. A rash can be a medical emergency if it occurs when someone starts a new antibiotic. Keep an eye out for signs of allergic reaction like rash, facial swelling, and difficulty breathing, and call 911 if these occur. Sedatives. If an individual is taking a sedative, like sleep medication, anticonvulsants, and some psychiatric medications, and some pain medications, watch out for and report any major changes in mental status. Check frequently to see how the medication is affecting their breathing. Make sure they do not stop breathing, and if they do, call 911. Do not drink alcohol while taking sedatives. Alcohol and sedatives work together to depress the central nervous system, slow heartbeat and breathing, and can cause death if the heart slows to a stop. Anticonvulsants. If an individual is taking a seizure medication, you should report excessive sedation to the doctor. If you are with someone when they have a seizure, make sure to stay with the person until the seizure ends. Move any furniture out of the way to protect them from hitting it, especially protect their head from hitting anything, and do not put anything in their mouth. Observe them before, during, and after the seizure in order to complete ASN seizure report form to submit to your division manager. I will show you what that looks like on the screen. Call 911 if one or more of these are true. The person has never had a seizure before. The person has difficulty breathing or waking after the seizure. The seizure lasts longer than 5 minutes. The person has another seizure soon after the first one. The person is seriously hurt during the seizure. The seizure happens in water. The person has a health condition like diabetes, heart disease, or is pregnant. Anti-diabetic. If an individual is taking diabetic medication, watch their diet to prevent high or low blood sugar. Hyperglycemia, which is blood sugar that is too high, looks like someone who is intensely thirsty, urinates frequently, has blurred vision, and feels weak and tired. If this individual is prescribed insulin and experiences these symptoms, they should self-administer insulin as prescribed. Hypoglycemia, which is blood sugar that is too low, looks like someone who is anxious, dizzy, shaky, irritable, hungry, and sweaty. If this person has juice, milk, or candy available, they should drink or eat some of that. Find out if the individual with diabetes sees a nutritionist, and if they don't, set up a visit for them to ask their primary care doctor for diet advice. A healthy diet, combined with anti-diabetic medication if prescribed, keeps blood sugar levels steady and helps prevent medical emergencies. Thyroid. If an individual is taking medication for their thyroid, some of these medications must be taken early in the morning on an empty stomach. They should report severe weight loss or weight gain to their physician. Anticoagulants. If an individual is taking anticoagulant medication or blood thinners, watch out for increased bruising and bleeding. Try to avoid injury since it is more difficult to stop bleeding with these individuals once it starts. Avoid aspirin and foods high in vitamin K, such as leafy green vegetables, since they both affect bleeding. Analgesics. If an individual is taking medication for pain, over-the-counter medication should be taken with food in the stomach. Medications such as Tylenol, Advil, and aspirin irritate the stomach lining. Report tarry black or bright red stool to the doctor, as this may indicate internal bleeding. Painkillers often cause constipation, so assist the individual receiving support to eat healthily, increase fluids, and exercise regularly while on these medications. Prescribed painkillers must be taken only as directed and closely supervised, as they can be highly addictive and also deadly if taken in excess or with alcohol. Do not take prescription painkillers with alcohol. Psychiatric medications. If an individual is taking psychiatric medication, watch for changes in their behavior. Psychiatric medications include antidepressants, antipsychotics, and anticonvulsants prescribed as mood stabilizers often cause changes in sleep, appetite, and weight. If an individual receiving support takes antipsychotics, these are a few of the side effects which you should report to the doctor: tremors, lip smacking, muscle rigidity, new repetitive movements, and restlessness. In order to reduce these common side effects of antipsychotic medications, doctors can adjust dosage or prescribe drugs to target these side effects. Side effects. Always be aware of medication side effects, especially when a new medication has been ordered. Any medication, prescription or over-the-counter, can cause a side effect. You should especially be observant for an allergic reaction to a new drug. Some life-threatening allergic reactions include itching or swelling of the tongue, itching, sense, or tightness of the throat, a hoarseness or wheezing, hives, itchy rash, swelling of the face or extremities, severe vomiting and/or diarrhea, shortness of breath and/or loss of consciousness. These are all medical emergencies requiring you to call 911. Anytime a medication interferes with breathing or suddenly and severely alters mental status, the person needs immediate medical attention.
Section 4, General Guidelines. Specific medication warnings. Too much Tylenol, generic name acetaminophen, can affect the liver and cause liver damage. The risk for liver damage increases if the individual drinks alcohol while taking acetaminophen. Non-steroidal anti-inflammatory drugs, abbreviated as NSAIDs, including aspirin and ibuprofen, can cause stomach bleeding. Risk factors that can increase the chance of stomach bleeding include taking high-dose NSAIDs, smoking, drinking alcohol, having untreated stress, taking prescription blood thinners, or having a history of stomach ulcers. NSAIDs can also damage the kidneys. Risk factors for kidney damage when taking NSAIDs are being over 60 years old, having high blood pressure, kidney disease, heart disease, or taking diuretics. Discontinued or expired medications. If a medication has been discontinued by the prescribing physician or nurse practitioner, or the medication has expired, the medication must be disposed of properly. You may bring expired medications to the ASN nurse's office at Isaac's Orchard location, or dispose of it at your local police department if they have a drug disposal box. The website www.fda.gov provides a list of medications that could be flushed down the toilet if no other disposal option is available. Most medications should never be flushed down the toilet, since that can contaminate public water and affect everyone's health. So on the website of fda.gov, you can search flush medications, click on disposal of unused medications, what you should know. You can scroll down and find a PDF list. So this list includes some very strong medications, including morphine, oxycodone, oxymorphone. FDA believes that the known risk of harm, including death, to humans from accidental exposure to the medicines listed above, especially potent opioids medicines, far outweighs any potential risk to humans or the environment from flushing these medications. FDA will continue to conduct risk assessments as a part of their larger activities related to the safe use of medications. So the FDA does not recommend flushing, but they recommend it if the only other option is keeping a medication in the house after it's been discontinued or expired. Medication errors. Medication errors are to be reported promptly. Examples of medication errors include missed medication, wrong medication, medication taken by the wrong person, wrong amount of medication, medication taken at the wrong time, medication taken in the wrong manner, discontinued medication being taken, or expired medication being taken. In addition to calling the incident in to your division manager, If you believe the error is likely to be dangerous, such as excessive amount of medication administered to the individual you support, immediately contact the National Poison Control Center at 1-800-222-1222. Keep this number posted by the individual's home phone. General guidelines. Medications are only to be given as prescribed. Know the name and purpose of each medication belonging to the individual you support. Know who the prescribing physician is and how to obtain refills. Be aware of all the medical conditions of the individual you support. Be aware of all medication allergies. Stay with the individual while they are taking their medication. Observe for any side effects of the medication, especially when a new medication has been prescribed. Medication is to be recorded once the medication has been taken. All medication is to be stored in a locked box, even medication that is to be refrigerated. You can contact your division manager or the medical coordinator if you need a separate lockbox for refrigerated medications. Do not leave medication unattended. Get the doctor's approval before giving an individual over-the-counter medications or vitamins. Plan ahead for refills. Do not wait until the last pill is given to request a refill. If the individual receiving support has an inhaler, make sure you know where it is at all times and check the expiration date frequently. If you have any medication questions, you may contact the medical coordinator at Arkansas Support Network at 479-927-4100, extension 2235.